Are you looking to level up your shoulder game so that your shoulders feel better, improve your mobility, and help your pressing strength or your sports performance? This is going to be the video for you. Let's get to it. Hey there, Prehab here from Thirst Gym, and today I'm going to help you improve not only your shoulder mobility and your shoulder stability, but get your shoulders feeling good so you continue to do the things that you love to do, whether that be lift weights, play sports, or just overall have your shoulders feel better in everyday life. Now, I've had some of my own shoulder complications in the past, mainly from heavy bench pressing, and as you can probably tell, I don't have the greatest shoulder mobility, but these are things that I use myself to keep my shoulders feeling good because I'm currently pain-free, and help my athletes improve their range of motion, or lifters improve their shoulder stability so they can bench press more and do all the things that they want to do. I bet you didn't know that on average, it's estimated that 1 in 3 people that go to the gym have some kind of shoulder pain or discomfort. And that can be for a number of reasons. One, we are more sedentary as we continue to age, right? We sit at desks more, we sit on our phone, we sit at computers. We have become a very technology-based civilization at this point. So we like to do things from sitting because we can get a lot of work done and be very productive. However, that's not ideal for our posture to be rounded forward all the time. And while I don't think posture is the only thing going after it, posture can be associated with things, especially if you're not already physically active, it can be considerably worse. If you are physically active, now it comes about learning how to train in the ranges of motion that you have and picking smart exercise selection and choices that's not only going to improve your shoulder stability, but over time let you improve your mobility so that your shoulders continue to feel good. So while you go out and do all those other things that you enjoy to do, your shoulders are not something that you're thinking about in the back of your head. So let's get into today's video about how I can help you improve your shoulder. All right, the first thing that we got to do here is we got to make sure that we assess where we're starting. And so I'm going to give you a couple different things that you can do. You don't have to do all these. By all means, you certainly can. But chances are one of these 3 bottom ones will do a good amount of giving you some information. But you can also do the impingement test as well. I think you should just do this one just in general. It will clear a lot of things out. And I want to make sure you know that I'm not a doctor. I'm not a physical therapist, okay? I am a strength and conditioning coach. I have been around a lot of shoulder issues. I have done a lot of education, and having over 15 years in the field, I've worked with a lot of shoulder issues and helped them get back to being better. So this is all anecdotal from based on what I've done. So if you are having some kind of medical issue, please go see a doctor, get their opinion first. That also gives me the ability to say what I want to say and give you my point of view, but also let you know, hey, there are other options out there, and it also gives me a little bit of liability to pass on to you to go see your own doctor. So with that being said, let's talk about these 4 tests. The first one's going to be an impingement test, and we get this from the FMS, or the functional movement screen. And so all you're going to do is you're going to take your hand, you're going to place it across your opposite shoulder. Hand is going to be completely flat, and while your hand is flat, you're going to take your elbow, you raise it up as high as you possibly can. As you can tell, my arm does not get up that high. It gets right around parallel to the ground, which is fine. But what you want to ask yourself while that hand is flat is, am I having shoulder pain? Am I feeling radiation? Am I feeling a pinch or twinge? Okay, that is going to let you know that you are very problematic or a very high degree of possibly having some kind of impingement. What that means is that a muscle is running through here, a tendon's running through here, and the space is closing down, and basically we're pushing into that. That's creating a little bit of discomfort, okay? Now, I do feel tight doing this, sure, but I don't have any kind of pain. The main thing you want to make sure you're not doing is just doing your fingertips and raising like this, okay? You're not actually doing the test right. Having our arm completely here, flat, and just raising up where we can is going to ensure that we do the test correctly, okay? It takes literally 3 seconds to do. You're going to do both shoulders. If that checks out, then move on to the rest of the stuff. If this causes you radiating pain or what have you, you're feeling a lot of issues with the impingement test, please go see a doctor, okay? Go see a physical therapist or a doctor, get a script, get an x-ray, get an MRI. There's probably something bigger going on that's completely outside of my scope, and everything I'm going to talk about in the rest of the video is likely not going to help you. Couldn't hurt, but again, do your due diligence there. The next thing we're going to do the FMS shoulder test. Now, again, if you have next to no equipment or next to no education, all you got to do is take your thumbs, you're going to place them in your hands, cover them up so you can't see them, and then you're going to take one hand, come over, one hand behind, and try to get them to touch as close as you can. Now, while you're doing this, the goal is to not extend like this to reach them. You want to just stay nice and upright. Arms going to come together. Get them as close as you can. Okay, then you'll do the other side and here. Okay. Now, in my line of work, I assign values to these, and I make sure that they're within certain ranges. And if they are, then they get scored appropriately. And that helps me dictate some of my programming decisions for my clients and athletes. However, if you're doing this by yourself, what you can do is just video yourself from your phone, do it one way, do it the other, look and see, is there a major difference? As you can tell with mine, there's a massive spread. That's not good. That's poor shoulder mobility, and that's okay. But you can use that as a starting guide, or if you happen to have a partner, friend, colleague, you can do that and you can measure them with a tape measure to get an exact distance, or you can also use your fists and count approximately how many fists you have. 1 fist, 2 fists, 1.5 fists, you get the idea, okay? Ideally, you would measure them with a tape measure if you wanted to be really, really critical about your mobility, but again, like I said, you are gonna need a partner for that, but then you would just take note, and then obviously you pay attention which one's worse, okay? If you have worse going this way, this shoulder is going through external rotation, this one's going through internal rotation. I know this, if like I'm here, this one's going through internal, this one's going through external here. I can then tell, by just looking at it, I can tell that this one here, for example, is much harder than going here. I'm right-handed, that kind of makes sense and checks out, but you would just denote that, and you'll be able to tell balance. We'll talk about the balance part here in a little bit. The next one's gonna be a little bit more clinical method, and that's measuring internal rotation and external rotation, or IR and ER. What that means is our shoulders here, internal rotation is gonna be our fist coming down towards the ground, and our external rotation is gonna be our fist going away from the ground. Okay, so ideally what you would need to have here is you need to lay on a bed or a table, physical therapy room, and basically you would lay on your back, and someone would help drive you into internal rotation as long as you're not dumping forward, but we're gonna see what your genuine internal rotation is. We're gonna get an estimation of how many degrees that is, and then we're gonna do the same thing back into external rotation. Same thing, we're gonna get an idea of what our external rotation is, excuse me. So you would just denote those numbers on each side, and you'll very quickly find that this is going to mirror this test, okay? This one's a little bit easier for the average person to do. This one's a little more clinical by just assessing the shoulder and the glenohumeral joint and just looking to see how it's moving at that position, okay? I use both of these in mine. I try to see how the athlete can actively get there, and then I try to see how I can passively get there. So I'm looking at 2 different things, but you're gonna get very similar results. Either one works. The other option is if you don't have a partner to do this, you clearly don't understand the internal external rotation thing, totally okay, no worries. Then you're gonna do the wall slide test. And all you're gonna do is you're just gonna take your back up against the wall as flat as you can, feet slightly a bit in front of you, arms are gonna be completely flat against that wall. And then what you're gonna do, you gotta be flat from head to tailbone. Okay, you want your back as flat as possible. And then you're just gonna reach straight overhead like you're doing an overhead press. And you're gonna go as high as you can, as long as you can keep the back side of your arms against the wall and your back flat against the wall and your butt underneath you. So you're not arching to do this to get here. You're as flat as you possibly can. You're going as high as you can. And then you're just gonna stop. Again, you could video yourself or take a picture of where you're at, and then you can measure your progress that way. Obviously, the higher that you get, the more shoulder mobility that you have, and that's gonna give you an idea. So these are the things that I recommend you do. Impingement test, for sure, non-negotiable, and then pick one of these that works well. Again, I use both of these in my current situation with my athletes and clients. Don't use the wall slide test because I get all my information from here, but pick one that works best for you, and then that's gonna let you be able to determine, okay, what do I need to work on, okay? If you're getting a lot of wall slides and you're going up pretty high and you have shoulder pain, chances are it's a stability issue, right? You have the mobility to get there, you're probably lacking stability at the shoulder joint. If you are incredibly tight like myself, you can't go anywhere, or your internal external rotation measures are really, really bad, as you can tell, like me, it's probably mobility and soft tissue work, so it gives us an idea of where we can begin to go to be able to address some of this pain or shoulder issues that you might be having. All right, the final thing we're gonna talk about here before we get into the actual practical stuff is just a little bit of anatomy, okay? And so the main thing that I want you to understand here about your shoulder is that too many people just look at the shoulder, okay? So they're looking at the glenohumeral joint, how that ball and that socket go together, and then how they work and move around. And rightfully so, that's kind of what lets you do all the awesome things that you do, and that's what makes the shoulder unique, is that there's so much range of motion about that shoulder versus like our elbow or our knee or an ankle, right? So think more than just the glenohumeral joint, but the glenohumeral joint is important still. You still want to have, again, good internal rotation and good ranges of motion. However, an area you need to also think about is your thoracic spine mobility or your T-spine mobility. You probably have heard this crammed down your throat. You're talking about extension and flexion and being able to rotate. Now, I will tell you that what you want to make sure you have happen is that ideally your back is somewhat curved. And people are going to say, well, isn't that weird? Don't want to avoid the hunched shoulders? That is correct. However, generally speaking, our neck is in a lordotic curve and our T-spine is in a kyphotic curve. And so that means that if this is my back and this is my scapula is slightly curved in like a C shape, it's gonna fit right there on that back, okay? And it's gonna be able to do what it needs to do naturally. Now, if this back is over curved, then it doesn't sit very flush. I've got space right here and space below. That's not gonna sit too well. Or and what happens for a lot of people is they're in this extended position, and so they're stuck forward here, chest is tall, and so really their back is actually basically straight. I'm gonna over exaggerate this here, but we're gonna say that their back is this way, it's really pushed forward, okay? And then we try to put a scapula on that. You can see how that's not gonna glide very well, right? That's not gonna be something smooth and makes things feel good. So if we go back to our straight example though, if that's my back, this can't move around the rib cage fluidly, both upward rotation and protraction and retraction, which I'm going to get to here in a second. So we want to make sure that this is what we're trying to get after when it comes to our T-spine mobility, because if our thoracic spine is more mobile in terms of being able to rotate, not only side to side, but also to be able to extend and flex, right? We're in that good position from here to here. We have more movement. Then we have more movement variability, which is then gonna let our scapula move around our rib cage, because our rib cage is just gonna curve around with what our spine is doing, right? Okay, so our rib cage is pliable as well. Don't let somebody tell you otherwise. You can change the shape of your rib cage to some extent. And how that rib cage is shaped is important. So we wanna make sure that, again, we're not compressed from front to back. That really squishes it out like this. Or if we're pushed really far together inside, that again gives us a really big C curve that we talked about, okay? And I'm not gonna go into ISA stuff and anything like that, but understand this is kind of what you're after here from a T-spine mobility. Now, like I said, as I mentioned, that leads us to our scapula upward rotation. And so if we look at this from a back side, and we'll just say that this is my scapula. Again, I am a terrible artist, so just bear with me here. If this is my scapula and it's naturally sitting on my rib cage, if it's nice and flush and does what it's supposed to do, it's going to upwardly rotate when I actually go to get overhead. And it's just gonna slide right up, right? And it's gonna feel pretty good. You're gonna be able to get your shoulder overhead. You're not gonna have to crank through extension to do it. You're gonna just raise your arm straight up overhead and do all the things you wanna do, ideally, probably with no pain, more than likely. However, what happens if we have that really pushed forward, a compressed spine, this doesn't go very well. And so it doesn't go up as much. It only gets to a certain point and it stops because it's literally running into itself. It's running into other anatomy structures and therefore it stops. And then we have to compensate. And that compensation is going to come from extending more. So I'm actually moving my rib cage to get it into position. I'm not actually moving my shoulder. So you get the idea there of how that works with the scapula. We also understand that we have to protract and retract. So the same thing, my scapula is sitting here. If I want to reach forward, this should be able to come around the rib cage. And so when you reach forward like this, my scapula is actually coming around. So part of good quality shoulder health is being able to protract and reach forward. And that's usually going to create more of that C curve on our back. That's going to be able to create a better relationship with that scapula. Too many people are often taught to always pull those shoulder blades together, really retract. And again, there's nothing wrong with retraction or depression of pulling things together, feeling good quality back musculature while we're doing our back musculature, that's fine. But you also don't want to be like this all the time, okay? We're gonna run into where, again, that spine's gonna be basically the opposite. It's gonna curve this way. I'm over exaggerating here, but it's gonna curve this way, and then I'm not gonna get a good quality relationship. So it's always somewhere in the middle. We wanna make sure we can reach and we can retract, again, without pain, but also the scapula is moving around the rib cage the way that it's supposed to. All of these being taken care of is going to lend to genuine shoulder movement and good quality mobility. So some of the tests that we did can mainly just looks at, again, the humeral joint. There's not really a way to like truly test, measure all that motion. I'm not a PT or I'm not in a clinical setting, so I'm not going to be able to do that. I'm trying to use something actionable right now. But if you understand that we have good movement in the glenohumeral joint, we have good movement at the thoracic spine, and if our thoracic spine motion is good and we have good quality upper rotation, protraction, retraction, I guarantee you your shoulders are going to feel good. And the exercises we're about to talk about are going to make sure that we address all of these things to immediately improve your shoulder mobility and your shoulder stability. All right, here's what you're going to need to do if you're wanting to improve your shoulder mobility and get things feeling good, okay? These are kind of like my big five, all right? So the first thing is not counted towards that big five. but SMR, or basically foam rolling soft tissue release work. This for your shoulder, you are going to want a lacrosse ball or a golf ball or a baseball, softball, something like that. You're going to take some time and roll that into your chest musculature and your upper back and your lat, okay? That's going to, again, give you the ability to maybe get into some ranges of motion, especially if you're incredibly tight at the muscular level. This can help you feel relatively good. Again, you don't have to do it. I personally like doing it during my training. I show my athletes how to do it, especially if they're overhead athletes like baseball, softball, tennis, swimming. They're spending a lot of time overhead. We want to make sure that that tissue quality is as good as we can possibly get it, especially coming in the training room multiple times, right? Again, you don't have to be married to it. You're going to find literature that's going to say that's great. Others are going to say it sucks. You do what works for you, but for me personally, I always feel better after I do it, especially when I go into my next couple things. All right, the first thing I like here is a cat-cow. Some people call it cat-camel, call it whatever you want to call it. Basically, where you are on all fours and you're extending and then rounding, extending and rounding, okay? So just so you know, I'm gonna have all these linked in the description box below. So you wanna see each individual exercise, you will have a full breakdown from 3 to 5 minutes of each exercise of how you can immediately implement it into your training program. But the cat-cow, as we talked about earlier, we wanna focus on thoracic extension and flexion, okay? We're really just trying to move around that T-spine area. And so all we're trying to do is just gradually increase range of motion, do the best we can. I really like doing this for about 10 reps and then moving on. Okay, it doesn't have to be anything crazy. If you are feeling like it's getting you more range of motion as you're going, do more. If you feel like it's not doing anything for you, you could do less, okay? 10 is just a nice, good, even round number, something to shoot for. 10 extensions, 10 flexions. Once you've done that, because we're already in a kneeling position, I then like to go to a band-assisted quadruped T-spine rotation. This is what you're going to do is you're going to be in that same position, hands and knees. You're going to take a band, you're going to put your arm through the band, you're going to wrap your body around it. That band is going to be tied to a rack, door, what have you. And from that position, if my shoulder here is tied in the band, my hand's going to come up here by my head, and I'm going to rotate, exhale, and that band's going to help me rotate towards it, okay? And so what that's going to do, again, it's going to work on the rotational aspect of our thoracic spine, but the band is going to assist us. So we're going to have that band pull us into new ranges of motion, and we want to make sure we're getting some good quality exhales there. Breathe in, breathe out, feel it. Do it again, breathe in, breathe out, and try to get a little bit further each time. You're going to feel that really open up on the side, like the obliques, the lats, the mid-back. You're going to feel all that open up, okay? Do both sides, and I really like to do 8 of these on each side. Okay, again, you can do more, you can do less. This is just what I like to do for myself. The next one is going to be the kettlebell arm bar. To me, this is the most underrated thing on this list. This has fixed so many shoulders in my facility in terms of dealing with nagging issues, pains, just everything feeling not too good. It's helped with elbow and wrist issues as well. Kettlebell arm bar, you're going to take your hand through the kettlebell. You're lying on your back, and that kettlebell from here, you're just going to roll your body over sideways, and as you do it, you're going to reach towards the ceiling, and you're going to roll your thumb away. Again, external rotation, and then you come back, we're going to roll back into internal rotation. So what's nice about this is, again, we're going to pair some of this rotation from the T-spine, which is great. We just opened that up. We're going to continue to use that to our advantage, and then we're going to use that kettlebell to push us here, work on internal rotation at the glenohumeral joint, and then on top of that, we're going to get some stability work because we got to balance that weight. If you want to make this harder, you can do a kettlebell bottoms up. It's going to challenge you even more. It's more of an advanced variation, not needed, but if you are looking for that kind of challenge. But then also having to reach forward is then going to get our serratus and that protraction. Okay, it's going to give us that reach as we go to come here. So you're going to get a lot of good things here from just this one exercise. And as you can tell, these kind of feed into the other. This, I like to do 5 on each side. Nothing too crazy. You want to take your time on these. They should be slow, deliberate, really trying to feel yourself really rotate. This may even end up popping your back. Same thing with that rotation. Next, we're going to go to a band pull apart super series. Now, I'm going to have this linked here. I got this from my guy David Allen and Christian Anto from MBS way back in the day. This is basically 70 reps of band pull aparts, but we're going to do things from a pronated and a supinated grip 3 days from 3 different positions. And what that's going to do, that's going to let us to activate our upper back. It's going to be able to get our traps involved. We're also going to be able to get our internal, external rotators involved as well as we're doing some of these band pull apart variations. And the final one's overhead pulling down. And that's going to help keep your chest wall open as you go to do that here and kind of get those lats working. It's nothing crazy. Again, you're not going to get like a pump, but it's going to get your shoulders warmed up and feeling really good. And aiding the stability even further. And the last exercise is a seated dorsal rostral expansion. Now, this I don't do before my warm-up, okay? This would be a post warm-up or just an off-day thing. This is not part of my normal training routine. But for people that sit at desks a lot, this is gonna be great for you because you can do this anywhere at your desk. You're just gonna need a band. What we're gonna do is we're gonna take that band, place it around our wrists, our hands, our elbows are gonna be on the desk. We're gonna do like this, pretend like we're reading a book. We're gonna try to create as much space as we can between ourselves and that book that we're reading. I'm gonna take my hands, drive it out into that band, just enough to create tension. I'm not trying to extend, okay? Just create some tension. You're gonna feel your upper back turn on like crazy. You're gonna be like, holy crap, I can really feel my rotator cuff working. And then all we're gonna do from this position is drive our elbows down just slightly so that we can feel our abs. And then we're just gonna inhale, exhale. As we exhale, that you're gonna feel your hands wanting to come in, keep that drive out. And what that's going to do, as you can tell from me being in this position, that's gonna allow for some upper back expansion. So if you are dealing with a lot of tightness, this can help that feel good. It's also gonna turn on your abdominals, it's gonna help keep your rib cage down, and it's gonna strengthen your rotator cuff muscles at the same time. I like doing this for 5 breaths and then just retesting how things feel. Again, if you're a desk worker, you can microdose this. Just do this like once every hour, every other hour, and I guarantee you your shoulders will be feeling good. But you can also do this in the gym, at home. You can do it really wherever you want. But this is just one of my go-to exercises for relieving upper back tightness, especially if you feel that like that trap tightness. This is gonna hammer that really good. And like I said, the band pull-apart series is just 1 round. Again, I will have that in the description box below of every single piece of that, along with these. But if you go through this step before you go to do like an upper body day or something shoulder related, this will help your shoulders immediately feel better. All right, the next thing I want to address here is some of the general strength training stuff. And one of the big things that you'll see commonly pushed is a 2-to-1 pull to push ratio. And what that means is you'll do 2 sets or double the amount of reps or double the amount of exercises of pulling exercises versus your pushing exercises. And the reason I have the question mark here is that really true? Is that really going to make a difference? Now, I'm going to tell you, it depends, okay? It depends on your training history, what you've done, what's going on with your shoulders, you know, what are your goals? That's also going to be a big factor here. From what I have found, that for most people, they probably don't need a 2-to-1 ratio. I think they just need a better exercise selection of their pushes, and then their pulls can be probably 1.5 to 1.25 of their actual pushing exercises. And the reason I say this is, okay, I used to be in this camp where I thought the 2-to-1. I thought for sure, if I'm gonna bench press 5 sets, I need to do 10 sets of rows to offset that, to pull me back. Again, we were talking about how being pushed forward was not good because that scapula can't glide across the rib cage, right? So if we're constantly doing pulling exercises, here, I'm gonna end up always in this position. I'm reinforcing this position. That's not a good quality thing for my scapula health. Again, it might keep my shoulders back. I might be able to be a little more chest proud, but I don't need to be walking around like this or have this greater posture. And I know that the argument is gonna be, well, you're not gonna be in that posture, but it's gonna strengthen it so that you are more neutral. And again, that could be, if you're somebody that's walking around like this all the time, then I am 100% going to agree you need some back work. However, if you're like myself, I actually kind of walk around like this because I'm so pushed forward in space, my pelvis is so far done forward, that by being forward, doing more stuff like this is pushing me more forward, okay? I need to do stuff that gets me to reach. So again, I can still do rowing exercises. I'm just going to make sure that I'm in a good quality reached position every single time that I do it. I might even try to get an inhale here, especially my lighter accessory work, okay? And again, we have to think about too, if I'm pushing overhead and dirty pulling, again, that's gonna lead to a lot of pulling. You're not gonna do as much pushing. So making smart exercise choices to me is the clear-cut winner, not being married to this. I also think if you're doing the general shoulder health stuff I talked about with the warm-up stuff, that's gonna help negate some of this and give you more mobility work. Again, if you need more shoulder stability, or you are that person that is just so far rounded, you're walking around like this, then yes, I'm gonna say the 2-to-1 ratio is probably a safe bet. But I don't want you to be married to this, okay? It's just a general guideline. And I think if you're in doubt of what to do with your workout, it's probably not gonna be a bad thing if you double down on your pulling versus your pushing, especially if your history has shown that you always went in and bench pressed on Monday and you very rarely do anything else other than lat pull downs or chin ups, right? You could probably get away with doing some more chest supported dumbbell work. You could do some single arm dumbbell rows. You could do some seated cable rows. You could do some inverted rows, right? Those are all great things that's going to develop your back musculature and keep things more balanced. And that's really what this is after, is trying to be able to create a balance. However, the balance is really going to matter depending on how you execute the exercises and the options that you're picking over being married to the ratio. Okay, we're going to talk about some modifications that you can do if your shoulders are feeling achy or bothering you, okay? Now, the first couple things I'm going to talk about if you can't bench press, okay? Or if bench press is causing you pain, what should you do? Okay, if you want to try to do still a bench press, my first suggestion is going to be to try to find a Swiss bar or a multi-grip bar. And you've probably seen these bars before, but their hands are going to be neutral. And by being neutral, that means our shoulders weren't externally rotated. It's going to create some more space. Generally, this is more shoulder friendly for a lot of people. And most people can usually press with this, okay? The other thing that you can do is you can also then limit the range of motion. Okay? And so what you can do here is you can use like a board press board or a shoulder saver from Elite FTS, or you could even set up pins and bench press with the pins, and that's going to, again, limit the range of motion from you being in a vulnerable position or something that's causing you issues. Again, just a way for you to continue to press horizontally if you're so far inclined. And then the final option is then going to be bands and chains here. Okay, and what this is going to do is still going to allow you to press to some degree, but as you come down, that load is going to be less here in the more vulnerable position, and it's to still let you press and get some overload. So you have to play around with this, see what still works best. If none of these work, then we get rid of the horizontal pressing here, especially from a barbell perspective, which then gives me my next option here is that then you look at dumbbells. Okay, now what you can try doing is neutral grip dumbbell presses, and usually what you'll find is that you're not locked into one unit. Each shoulder gets to work separately and independently. You're going to stabilize them a little bit differently, and that extra stabilization that you're having to focus on may make your shoulder feel better, making it, again, less painful or eliminating the pain altogether. So that's how you continue to do horizontal pressing with load. And then, of course, you could also try machines and push-ups. Now, push-ups for me are a great one. I love these for people that have shoulder issues because we're going to actually get some protraction that's going to get that shoulder blade moving, where with any of the bench press variations, your shoulders are actually pushed against the pad and they can't really rotate because you're keeping them pressed against the pad, right? At least if you're pressing correctly. So that's an issue with the bench press in general, is the fact that we are not allowing the scapula to move, where with even machines you usually can't. Sometimes there's some of the free weight ones where you will actually move and the thing will kind of stay still. Those are kind of rare, but I have seen them. But the push-ups are going to allow your shoulder blade to move. So this is kind of like a almost guaranteed to probably not cause you shoulder issues if you're doing them correctly. Okay? Now, let's just say none of that works. For whatever reason, you cannot do that. Then what we're going to do is we're going to move into a different angled position. So you're just going to change the angle of going up here versus straight in front of you, okay? And so by being up here, what you can find is that, again, you could use a neutral grip, or you could use dumbbells, or you could do like a feet elevated push-up, and that lets you still train some of the pressing pattern, but being up here, that's going to get that scapular to upwardly rotate a little bit as you're pressing, and it's going to naturally bias you to having that upward rotated position, ideally probably in a range of motion that you have if it's out here. So another way to get around it, or you can go the opposite direction. You just go the opposite direction here. You could do everything from a decline and give that a go. Now the decline is going to have less range of motion, so when it comes to building muscle, not going to be as ideal from my first perspective. But if you're doing pressing down here versus up here, that's going to be in a better range of motion that your body can likely do, whether it be dumbbells, barbell, doesn't really matter. So decline would be the other option. Some gyms, you're gonna have a hard time setting up an actual like decline barbell bench press, so dumbbells are probably gonna be the only option, or a decline machine. But you can give all those a different shot. Those are just different ways to look about how you can adjust the angles of your pressing to play around with that as well. Now, when it comes to the overhead press, okay, so if you're doing barbell overhead press, you're gonna see a lot of the same suggestions here. So my first suggestion here is then going to be, can you try that Swiss bar? Will that actually alleviate your pain? Can you do something that's going to limit range of motion? So maybe you're doing them off of pins, or you're using like a log where it's bigger and you're here. Different options there. Or can you maybe even do like a reverse band setup or any kind of bands and chains? And that also, again, will allow it to be less here and more at the top. These are a little more nuanced to set up. So for most people, you're going to probably find the Swiss bar is probably the easiest option for trying to stick with the barbell. Or you can go to a dumbbell option. Again, same thing, neutral grip overhead, or you can try the machines. Okay, those are going to be all the ways to work around directly pressing overhead. Now, for most people, you probably don't have the range of motion to press overhead ideally. So again, this works probably better if you're having pain, to make sure that you're in a position to where you can actually get overhead, because again, with a neutral grip, you can actually get overhead much easier than if you can in a pronate position. You'll know that if you did your wall slide test, as I mentioned. Now, the final one be the modifications that we're going to do here. Same thing, but we want to actually make sure we're only going to an incline. It's going to still let us train our shoulder in an upright position. Here, again, you can still stick with the dumbbell work. That's also fine. But here, the big one for me is going to be the landmine. Okay, the landmine to me is the go-to for when people are having shoulder issues and they can't press overhead. The reason is, one, we can get close to being overhead, right? We're still out in front. What's great about that, again, is that shoulder blade is going to come around the rib cage. And when it comes around the rib cage, it's a good quality for traction. We're actually training in a range of motion that we actually have available to us. We're also, depending upon the position, you could be in a half kneeling, tall kneeling, split stance, staggered stance, lots of different stances here. Generally speaking, your torso work's going to get some work because you're probably going to be doing it unilaterally, and that's going to get your torso to cinch down a little bit, create a little more system stability, and that's going to then allow your shoulder blade to move around your rib cage more effectively. You can also implement reaches or whatever, which also is going to help with general rib cage mechanics with running and things like that. So the options here are limitless in terms of kind of what you can do, and it also is just going to feel good for majority of people. You can do the landmine with one arm or with both if you happen to have like a Viking press attachment. That's also a fantastic option. And if you don't have access to that, you can put it in a corner with your gym owner's approval, or you can just buy a nice cheap landmine thing from Elite FTS, Rogue, Amazon, wherever you can get them, and just put them in a couple plates and be able to do it at home if you're like in a garage gym or something like that. So that would be my go-to for the all things overhead pressing. All your training is pretty much going to stay the same, right? If you're training for hypertrophy, you train in those ranges. If you're training for strength, you train in those ranges. If you're training for power, you train in those ranges, right? None of that really changed. We just want to find the implement and or the angle that works best, that we can do the exercise and train similar and or surrounding musculature that we would if we didn't have to make the modification. It just may not be the barbell overhead press or the barbell bench press, which at the end of the day is entirely okay, especially if you don't compete in strongman or powerlifting. All right, let's talk about 3 things you can do at home if you want a quote-unquote fix to help your shoulders. So I understand if you're watching this video, you may not be going to the gym all the time, or you're looking for something immediately now that can help your shoulders just feel better, okay? And the first one is going to be a good old classic doorway stretch. And here what you're going to do is you're going to actually just find a doorway. Just like I said, you're going to put your arms in the doorway, staggered stance, one leg in front of the other, and you're going to slightly lean into that and hold that position and take a good inhale, exhale, and further stretch into that. While we're doing that, we want to make sure that we're not extending through that thoracic spine. It's the number one mistake people make, is they extend while they go to do this, okay? We want to keep our ribs down, actually feel our abs a little bit, keep our pelvis underneath us. We don't want our butt super stuck out here, and then inhale, exhale, and then go down, okay? That's going to let you get more actual shoulder joint. And again, if you are in that extended position, we don't want to further do that, right? We want to just make sure everything's as natural or as neutral, quote unquote, as possible while we do that. And it's going to give you much more of a better stretch here throughout your chest. All right, the next thing I want to have you do here is going to then be a windmill. And ideally like a side lying if at all possible. All right, so we did a good quality stretch. Again, I would say do this for about 3 to 5 sets of 30 seconds and just good quality breaths here. On your windmill, you're just gonna sit in a 90-90 position on the ground on your side. So knees are up like this, basically you're sleeping on your side. You're gonna take your top arm, and what you're gonna do is you're gonna make a big circle, put your hand out in front of you, bring it all the way around, follow that hand and try to get your shoulder blade to the ground, and you're gonna repeat that circle, okay? What this is going to do is one, it's going to work on that thoracic rotation like we talked about, okay? You're gonna work through some rotations. You don't have a kettlebell or maybe something to really help get you into that position better. This will do a good job of allowing to work on that thoracic rotation, opening up your T-spine. So you've already opened up your anterior chest wall or your chest area. Now it's gonna be easier to rotate into that position as you go to do this exercise. And again, I really like this, again, for 3 to 5 sets of 8 to 10 per side. Okay, just feel these out, do as much or as little as you want to, but these are just gonna be good numbers that work well for you. And then the last thing that we're going to do is we're going to do a band pull apart, super series again. And if you don't happen to have a band, then what you're going to do here is you're going to do scap push-ups, and you're also going to do your wall slides. Okay, we're gonna do both of these since we don't have anything to work on our shoulder stability. We're going to do 2 exercises here. So you would just do your wall band pull apart, 1 to 2 rounds, and that's going to cover that. If you can't do that because you don't have a band, totally okay. We're going to do the same thing, 3 to 5 sets of anywhere from 5 to 10 reps, not very much, just enough to feel it out. And then your wall slides, same thing, 3 to 5, 5 to 10, okay? And you'll go back and forth with these. So a scap push-up, I'm gonna recommend that you always start with your knees here, because more than likely, if you start from your feet, you're having shoulder issues, you're probably gonna botch and not do it correctly. But every time you're doing your push-up, you're actually gonna come here, you're gonna reach, and then you're gonna just sink here. Okay, you're not actually gonna do the push-up, all you're gonna do is the scapula action part. So you're gonna protract as far as you can with your body weight, and then you're gonna sink into that, let that push them together, and then use that serratus to reach forward. That's gonna get you the reaching forward part, again, helping to allow for that curvature, also get the serratus stronger. And then your wall slides is what you're gonna do to develop some of your upper back strength here and improve that as you're going up and down, trying to get a little further with each rep, strengthening the back side of the shoulder girdle. And since you got everything opened up and you've gotten that serratus, you've created some space, now your scapula should be able to move a little better. So by going back and forth here, you're should be feeling some improvement on both fronts, but doing that. So you have a couple different options here. These for sure you can do because they are just body weight, okay? If you have a band at home, go with the band pull apart variation. I think it's quicker. It's gonna be a little bit better. It's also gonna give you a little more actual stability at the glenohumeral joint. But again, if you can't do that because you don't have a weight to do that, these will work to be able to focus on some stability in that area, but through different means, but you'll still see progress. And again, this should only take about 10 to 12 minutes, okay? You could do this any point during the day, while you're at home, when you wake up, before you go to bed. I would try to microdose it 2 times a day if you're really having some shoulder issues, but if you're doing it every single day, you will notice that your shoulders start to feel better. All right, that's gonna wrap up today's video on how to improve your shoulder mobility and stability, helping your shoulders feel better. Again, this is pretty exhaustive, giving you quite a bit of different options, whether you're doing stuff at home, you're doing it at a gym, and also going the different issues that you could be having of why your shoulders are bothering you. Again, if you really need help, I would recommend seeking a medical professional. But again, this is just anecdotally for what I've seen with my clients and athletes and what has worked well for myself. So again, they do work for some people, but it may not work with you because I do not know your exact background. But feel free to give them a try if it is something you have been dealing with shoulder pain, you're trying to get around some stuff. This could potentially help you get back to bench pressing, overhead pressing, and doing all those overhead things or shoulder-based things that you happen to do. If you happen to like today's video, do me a favor, hit that like button, subscribe, leave me a comment, let me know what exercise did I leave off that maybe you really found helpful, and I'll see you at the next video.